Commonly asked psychiatric nursing topics in the actual exam. Psychiatric drugs. 1. Psychiatric drugs are preferably given after meal except minor tranquilizers, anxiolytics. 2. Haloperidol is commonly given for psychotic patients. 3. Extrapyramidal syndrome, EPS, is commonly caused by haloperidol. 4. COGENTIN and BENADRYL are drugs usually administered to decrease symptoms of EPS. 5. CLOZARIL causes agranulocytosis and leukopenia. 6. DIAZEPAM, VALIUM, is commonly prescribed for individuals with anxiety disorder. 7. Sedation is a common effect of diazepam, VALIUM, thus, safety should be prioritized. 8. PAXIL and ZOLOFT are antidepressants under the category of serotonin selective reuptake inhibitors, SSRIs, that can cause sexual dysfunction. 9. TOFRANIL and ELAVIL are commonly prescribed for depressed clients under the category of tricyclic antidepressants, TCAS. 10. Hypotension and urinary retention are anticholinergic side effects of TCAS. 11. MAOIS parnate, nardil, marplan, should not be given along with tyramine-rich foods. Example: avocado, banana, cheese. Except cream and cottage, and soy sauce. Hint: usually processed and fermented foods contain tyramine. 12. Sedation is an expected effect of antidepressants. 13. Energizing the patient to commit suicide is a paradoxical effect of antidepressants. Therefore, suicidal precaution should be instituted. 14. Levodopa is the drug of choice for patients with Parkinson's disease. 15. Drowsiness and hypotension are side effects of L-DOPA. 16. Dilantin is usually administered for patients with grand mal seizure. Tonic-clonic. 17. Gingival hyperplasia is associated with Dilantin use. Meticulous oral care is required. 18. Tapering the drug is strongly required if an anticonvulsant is withdrawn to avoid status epilepticus. This is due to abrupt withdrawal of the drug. 19. Diazepam, VALIUM, is commonly administered to combat status epilepticus. 20. Bone marrow depression and Stevens-Johnson syndrome, severe pruritus and bloodshot eyes, are worst effects of anticonvulsants. 21. Lithium carbonate is the drug of choice for manic patients. 22. Tegretol could also be given for bipolar manic client due to its mood-stabilizing effect. 23. 3 grams of sodium and 3 liters of fluids per day are recommended for patients under lithium therapy. 24. Nausea and vomiting are early signs of lithium toxicity. 25. Mannitol and Diamox are antidotes used to lower the toxicity. Lithium. 26. Cognex and Aricept are drugs used to treat dementia. These drugs increases liver enzymes, therefore, liver function test is required. ALT, AST. 27. Ritalin and Dexedrine are drugs commonly prescribed for children with ADHD. Insomnia and anorexia are side effects of these drugs. Growth suppression is the worst effect.